Hi everyone, I'm Sepida, a nursing student at Western University, and today I want to teach you about a common cerebrovascular disorder called acute ischemic stroke, which is an emergency condition that requires immediate medical attention and can be a life-altering event for you and your family. It's the second leading cause of death worldwide, and in Canada, about 800,000 adults have experienced a stroke only at the age of 20. Stroke risk rises rapidly with age. Now let's begin by asking you some important questions. When was the last time you checked your blood pressure and LDL cholesterol levels? Because these are the major risk factors. If you have high blood pressure, watch for symptoms and seek emergency care immediately, as every minute counts. Remember the acronym FAST. It's important to differentiate between stroke and Bell's palsy, as both can cause facial droop. Unlike Bell's palsy, strokes often present with additional symptoms like arm weakness and cognitive changes, and recovery can vary significantly depending on severity and treatment speed. During stroke, blood supply to a region of the brain is obstructed, typically due to occlusion of an artery such as the internal carotid arteries that bifurcate onto the anterior and middle cerebral arteries. This loss of circulation leads to oxygen and nutrient deprivation, primarily affecting brain tissues such as the temporal lobe, resulting in cellular injury and potential neuronal death. Ischemic stroke can occur in two main ways. In thrombotic stroke, a blood clot or thrombus forms inside an artery that has been narrowed by atherosclerosis, where fatty deposits or plaques build up. In embolic stroke, a clot or embolus originates from another location in the body, like the heart's valves and chambers, including atria, and travels through the bloodstream to block a brain artery. Atrial fibrillation causes the heart's atria to beat irregularly, leading to blood clots that can dislodge and potentially cause a stroke. Some of the risk factors for stroke are shown below. When blood flow to the brain is blocked, areas supplied by arteries like the middle cerebral artery become infarcted, forming an ischemic core where neurons incur irreversible damage. Surrounding this core is the penumbra, which can recover if blood flow is restored quickly, making it an essential target for therapeutic strategies like revascularization procedures. Under low oxygen conditions, brain cells shift to anaerobic metabolism, causing lactic acid buildup, decreased pH, and ATP depletion. This energy deficit damages mitochondria, leading to excessive reactive oxygen species, ROS production, and oxidative stress, which triggers apoptosis. Increased glutamate neurotransmitter levels results in excitotoxicity by raising intracellular calcium, causing inflammation that attracts white blood cells or leukocytes to the injury site. These immune cells release cytokines, which further recruit more immune cells. This inflammation weakens the blood-brain barrier, allowing harmful substances to enter the brain. Elevated calcium also activates nitric oxide synthase, contributing to cell damage. Mitochondria are a primary source of ROS during both ischemia and reperfusion injury. Some of the complications of acute ischemic stroke include cerebral edema, increased intracranial pressure, and cerebral herniation. Histologic changes appear within 12 to 24 hours, starting with neuronal swelling. Unlike other body tissues, the brain undergoes liquefactive necrosis characterized by a viscous material filled with inflammatory cells and debris. The image on the left shows the features of cerebral infarction and liquefactive necrosis. Ischemic brain tissue stops functioning within seconds and can start to necrose as soon as 5 minutes after oxygen and glucose supply is cut off. In terms of the functional consequences, patients may experience hemiparesis, facial paralysis, sensory loss, and cognitive deficits. Damage to speech muscles can cause dysarthria, while injury to language areas supplied by the middle cerebral artery can lead to aphasia, complicating communication. Survivors often require rehabilitation, facing a decreased quality of life, though recovery is still possible. Quick recognition of stroke symptoms and immediate neuroimaging techniques like CT or MRI are vital for diagnosis. Approved treatments include intravenous thrombolytics to dissolve blood clots and endovascular thrombectomy to remove them from the brain.